And my next guest is Maury Behar. He is from Personal Remedies, and I'm so excited because he's doing amazing things with food and diet and healthcare and wellness. Hi, Mory.
Hi, Sharon. How are you?
I was waiting for you to come on.
Same here.
Waiting. Tell me what you're working on.
Okay. We provide a fully automated yet personalized ability to provide dietary guidance that takes into account an individual's multiple chronic illnesses, health issues, allergies, dietary preferences, and medications. So basically, we make this concept of food is medicine a reality. As you know, food is medicine is a lot like teenage sex.
I can't wait to hear how.
Everybody's talking about it. Very few are experiencing it, and no one knows how to do it well until we came along.
Yeah.
So we basically provide ability for organizations to identify what food is appropriate or helpful or harmful for what illness or an individual's unique health profile. So that's basically what we do.
How are you doing this?
Okay, it took us a long time. I just look very young. We had to put a lot of work into this. But basically, there are a lot of science available out there about relationship between various nutrients and various illnesses. There is also a lot of publicly available information about nutrient content of various food items. So our algorithms, artificial intelligence-based algorithms, take into account all that data in order to make a connection between a food item and an illness. Basically, as you can imagine, there are no NIH-funded studies or clinical studies that tell us yet that tell us if grilled octopus is helpful or harmful for pancreatic cancer. And there probably never will be because nobody can get a patent on the octopus. But there's a lot of science available about nutrients and their impact on pancreatic cancer, a lot of nutrient data, and we take all of that into account in order to establish and quantify helpfulness or harmfulness of every food item as it relates to 200 plus chronic illnesses and health risks that we maintain in our knowledge base.
So I know everybody's talking about foods that are inflammatory. It
Right.
seems to be the buzz, right?
Yes.
What foods are inflammatory? Don't eat this.
Exactly.
So walk me through the experience. Say I am suffering from inflammation. Tell me what I would do and how I would experience your technology to learn what to eat and not
Exactly. One of the illnesses that we track actually is anti-inflammation diet.
eat. Great.
So the way consumers today can get that kind of guidance, we have anti-inflammation diet as one of the options within many of our apps. We have 42 mobile apps available in the market today. Each of them is focused on one chronic illness and its common comorbidities. Now, we have 9 apps, for example, for 9 different flavors of cancer. In each of those, anti-inflammation diet is one of the options someone can pick within the app in order to just address that, or microbiome health, or leaky gut syndrome. All of these are related to autoimmune diseases. And again, we want to make sure we provide people that kind of option to get dietary guidance for that. Also, enterprises, companies, providers, clinics, hospitals, food retailers, wellness organizations, and so on, they can use our API to access our knowledge base in order to make their platform look intelligent and allow them to offer personalized dietary guidance to their community that they serve.
So there's a massive data catch happening here.
Exactly.
That the more data you catch, the more people you help, the more you're going to be able to refine the diets.
Exactly. It's more capturing all the research. There is all kinds of awesome research available in the market that people just don't act upon, unfortunately. But there's a lot of research that tells you about impact of specific nutrients, supplements, herbal medicines, and so on various illnesses. But unfortunately, they are not presented in an actionable form. Unfortunately, you and I don't have 12 hours to read up on just one particular subject.
What I find fascinating is how you're not just targeting one aspect. You're looking at the person as a whole being. With
exactly.
Right in the beginning, you said multiple chronic illnesses
because most of us,
and allergies, which is, it all goes hand in hand.
Exactly right. Unfortunately, we live in a world that most people, adults over 50, suffer from at least 3 different chronic illnesses. And there is a void of information for that community because of the way our system works. Physicians, frankly, study only 20 minutes worth of nutrition in medical school. And dietitians, they all do the best they can, no question about it, but often they focus on 3, 4 very common illnesses: obesity, diabetes, heart disease. So if a patient comes along and says, but I also have a risk of prostate cancer in my family, or breast cancer in my family, or a woman comes and says, but I have polycystic ovary syndrome, or a man comes along and says, I have high blood pressure, now they have to go back and do some studies and poke around to find out, how do I revise what I already know about diabetes, obesity, etc., to guide this person?
Fantastic.
And not to mention the fact that dietitian is not sitting next to me when I'm in a restaurant. It's not sitting next to me when I'm in my kitchen trying to figure out what to cook. It's not whispering in my ears when I'm grocery shopping to tell me that vegetable is good because it's low in oxalate and I have oxalate kidney stones, but that vegetable is bad because it's very high in oxalate. So
thank you so much, Mory. This is fascinating. I can't wait to do it and learn
pleasure.
what I should be eating and
exactly.
not eating.
Well, it seems like you're doing a very fine job
Thank
already.
you. Are you flirting with me? Thank you so much.
My pleasure.
To
Thanks.
be continued.
Yeah.